Oh, no, it's just something to talk about in the future. I'm glad we started.
It's going on
But
somewhere
I
else
guess
and
Heidi's
at the top,
we talk
just
about every
getting
year,
it for the
maybe then I won't be
days,
so
raise
pumped
it
and miss things later, but.
You know,
And then
Yeah.
kind
I mean, I
of
think you can do it, but I think nobody wants to liability.
no crisis response.
I'll be agreeable. Isn't that one of the?
Yeah.
We did that.
Yes.
And then I bet there's another way to treat. He's got his school.
I should have reported on AMC too. I wasn't excited about any of those sessions.
I had two of them. I'll report.
But when I wasn't excited about them, but when I went to them.
We haven't
then I
quite started
really
yet, but the
appreciated it.
camera's
Like,
on, so
going
don't swear.
into it, I was just like, man, none of these
Did you go to
really.
the public meeting one? So, if you're not there, that'll be
And that's how I
person.
No, I was just, actually, I was talking with Jay about that.
Vice chair person.
I cannot.
Oh, Jay's not feeling very well, he says. That's,
Otherwise, I would have we could post something.
yeah. Live it up, Helen.
Thanks, Helen.
And then be clear about the
Video's going.
Fireman.
Thank you. Did you, which one are you wondering if I went to?
All right, Dave, put your boots on.
Put my boots on. Yes, I did. I didn't take.
All right, everyone, public that's watching, thank you for your patience. We're just shuffling as we do, and those of you that have been watching us for years and years, this used to be commonplace, where the county board took over the public health board, and we had to do with what we had. So this is the Public Health and Human Service Board meeting for Tuesday, December 17th. We are starting at 10:44. And we will call to order. We will start with the consent agenda. Is there anything anyone would like to pull from the consent agenda? Can I get a motion?
I so move to accept.
Support. All in favor?
Aye.
Any opposed? Excellent. So then we will move on to the staff report. But just a quick introduction, because I know this will make her incredibly uncomfortable. Our Mental Health Advisory Board, we have a chair that will be starting, and that is Andrea, who is here, so she's watching how we do things, because she'll be at the January meeting. You loved that, didn't you? All right. Delightful, wonderful staff, you can start.
Great. Well, good morning. Hello, everybody.
Morning.
I'm Grace Bouchard. I'm the supervisor for Children and Family Services team, and this is Anna.
I'm Anna. I'm the adult mental health case manager.
And also, Anna plays a role in our crisis response. She's one of the after-hours crisis responders, so I thought it'd be really great for her to be here so you can ask her questions exactly what truly does happen. But what I'm here to talk to you about today is crisis response after hours. Every county is required to have an after-hours crisis response team, and our region works together through a grant from the state to contract to provide services to our community for after hours. And just to clarify, what is a crisis or emergency? It can vary. You know, what's an emergency to me or a crisis to me may not be a crisis to you. So it's really important to talk to the individual and find out what's going on with them, and to dig deeper than the initial presentation of information. I think all of us have worked in emergent situations enough to know that what comes in is not necessarily what's happening. And so you have to really ask questions and learn more about what's going on. And so anybody can, just to be clear, that anybody can have a crisis, and it can happen to anybody that you know or love. And so just being aware of that can be really beneficial. I think when people have crises, they act in ways that we don't understand. You wonder, well, that doesn't seem practical, or why would you do that? But to think about everybody, that all of our behaviors, our best attempt at the time, given our resources and energy, to meet our needs. And it may not look like the best route for you, but that's what the person knows how to do in that situation. And so we may not understand that behavior. I would say that's especially true with somebody who maybe has been diagnosed with a mental illness such as bipolar or schizophrenia. Any of us could have crisis when a person has a more specific mental health diagnosis, their behaviors may look very different to us. And maybe we don't understand them. But whatever that individual is experiencing, it's real to them. And so it's always important for us to respond to people with having a crisis with compassion and understanding and not judgment. And always believe a person who says they want to hurt themselves or others. I think it's really important to take that very, very seriously. So who should call a crisis responder? Anybody who needs to talk can call. It doesn't have to be so bad, or a lot of times people will diminish what their need is because they don't want to appear to be too needy. I think a lot of people want to tough it out themselves, but I think the message we want to get to people is that it's okay to call. If you think it's feeling really bad, give a call. It's okay. Any of us can feel overwhelmed. The article that I wrote for the paper talks about the seasonal overwhelming experience that we have here at Christmas time, seeing families, purchasing a lot of things, not feeling like you have enough money, a lot of strains in that area. So that can really, if you're struggling, those kind of circumstances can tip you over. So anybody can call a crisis responder, and they can, the number, I gave you all a little card up front. It says, "Let's talk." And on the back, it has the number for the crisis response. If you would call that number, people are going to help provide you with resources, healthcare information. They can discuss with you if you're having suicidal thoughts, if that's a feeling, an idea, a plan, what is going on with that individual. They're going to help you sort that out, because I think that word suicide is very scary to a lot of us, and rightfully so, because we don't want to make any mistakes. And so that's why it's really good to take it seriously and work with people. Also assist with safety planning, not just for people who are feeling suicidal, but maybe if a person is struggling with chemical health, if that's their coping, if an individual's coping mechanism is to drink alcohol, that can really reduce somebody's safety. So to talk about how can you do something different than something that might put you more at risk. Anna, go ahead.
Can you cover a little bit, when you call this number, the amount of resources? Because I know that when I have been in a situation where I need to reach out, I always feel like there's someone worse, and I wouldn't want to take away from their time on the phone.
Yes.
Yeah, so,
It's a common feeling.
yeah.
And we don't often address it, we just kind of go over that, and so I don't want someone to, like, give up their place to make a call if they need help.
Yeah, so if you were to call the number on the back, you're going to initially be talking to someone from Birch Tree Center, and they have a lot of staff there. They cover more than just Cook County. They cover Carlton, Lake, and Cook. They also have a separate team that covers the Duluth area. So they are well-staffed there, so there's always going to be someone to talk to. You're going to be sent to whomever is on call. We have a couple people on call. If there were 2 calls at the same time, which we've never had that happen, but if there were, everyone who is a crisis responder is aware that if the other person who's on call is taking a call, that we might be getting a call. Even though we're not on the clock, we might be getting a call. And so we are aware of that, and we do, I know I personally keep my phone kind of close, just in case, even when I'm not on call, in the off chance that there is someone else who's needing assistance.
Yeah.
So just don't hesitate.
Yeah.
There's
don't
plenty of
hesitate.
resources. At times, there are times of the day when more people call than others, and I think a lot of times people think it's in the middle of the night, but really it's around supper. People come home from work. It's a stressful time. People are coming and going, and that time of the day seems to be very stressful and busy for people's lives. Maybe you've made it through your work day and you need to connect with somebody. So if you call at that time, you may have to call back again, or somebody may take your number and call you back. But that, again, that's the exception versus the rule.
Thank you.
So we will talk a little bit more about Birch Tree Center, but Birch Tree Center is a crisis stabilization facility, which means that it's a place to go for people who just want a safe place and some help getting their feet back on the ground. It's not it's voluntary. You can come and go. You can drive there. You can drive yourself there and say, I just need a place to regroup, and you can go there. Everybody has their own room, their own bathroom. There's food there. Your billing is through medical assistance. If you do not have medical assistance, there are funds to cover uncompensated care. As you know, private health plans don't cover for these kinds of things. Only medical assistance covers for mental health crisis response. But it's a service for all people. All people have crisis needs. And so, a person shouldn't hesitate about whether or not they have money to go to Birch Tree Center. It'll be covered one way or another. So as Anna was saying, we have a local team, local people for after hours. And so if you were to call call this number on the back and say, I'm calling from, they'll say, where are you calling from? And you say Cook County, and they'll say, okay, I'm going to connect you with somebody who's going to call you right back. And so they'll get the individual's phone number, and then they'll contact the responder. Is that how it goes?
Nope.
Oh, good.
When you call the number, they won't, we don't call them back, we just get patched through. They just forward the call to us. So we'll talk to the person that they initially talked to, and they'll say, hey, I've got someone on the phone. Sometimes they have a brief overview of kind of what's going on so that we know what's going on. Sometimes they don't. And so if they can give us a brief overview of what's going on, and then they just patch us right through, and then we're talking to the person.
Call forward. That is really awesome.
Yeah.
I didn't know that. So that's really nice for continuity.
Yeah.
And because you don't want to hang up on a person.
Yeah.
So that's really, really great. Well, great. I'm glad I got that clear.
What happens if someone gets disconnected? You have the number?
Yes, that's the first thing we find out is what is your phone number in the chance that we get disconnected.
Awesome.
Yep.
So, also this service is available to adults and children. So a child could call, a teen could call, a parent could call about their child's need. So it's really important to know that. Birch Tree Center is solely for adults, though. To go there, that's only for adults. But the crisis response service is for anybody of any age.
I have a question. I've been sitting on the AHA board, and one of the concerns that Commissioner Boyle from St. Louis County had was a place for families to go if a mother is having a crisis or emergency. She doesn't want to just leave her kids, and it sounded like there was a need there. I don't know if you have any suggestions or insight into solutions.
Yeah, that's a really good point, and I think that has been, even when Birch Tree Center was being established, we talked about postpartum depression, how important it is to not separate families and kids, or parents and kids. The real problem with this all is funding streams again. Only medical assistance pays for that kind of service. Plus, licensing becomes an issue too. To have adults and children in the same physical space is complicated. The only places we have that right now is in certain chemical dependency treatment centers of moms and kids. There's only one in the nation, I think, where dads can bring their kids, but otherwise it's moms and children can come in. And so that's a special license, and but I've never heard of a crisis stabilization center for mental health that has accepted children and parents. Even in the foster care realm, it's very difficult to find whole family foster care, which I think is a really wonderful idea, where parents aren't separated from their children. Generally, if there's another adult in the home who can assure safety, that it's best for children to be together with their parents while the parent recovers, and they can be there for that. It's much more secure. But it's a funding stream issue. There's just no way. So many of these aspects of crisis response is related to funding. There's not even there's minimal billable encounters related to any kind of crisis calls. So it's your first step in that pyramid of responding. It's your primary prevention, yet there's the least amount of funding.
Jerry?
I have a question, just to clarify, that if someone calls this number during the day, they will be talking to someone at Birch Tree Center, and the crisis responder would be an HTC employee? Is that how that works?
Not during the day, and that is a point that we need to address. During the day, the crisis responder will just work with the individual and refer them to the local social services agency, but we do not have
Okay.
anything really set up at this point, and that's, again, something we need to get certified for.
Okay, so the after-hours local crisis responder is, in fact, someone, well, you would be one, Anna,
Yep, for
Yeah.
after hours.
Right.
Sometimes.
in Cook County?
Non-call.
Yeah, but that's a very good point. They are, and it is, all crisis responders are HTC contracted employees. They provide the service, but, so they're contracted through HTC. But since we don't have the team here during the day, they don't provide the daytime crisis.
Oh, I see, okay.
Yeah.
All right.
So that is the gap that we're aiming to address in our 2020 staffing request, in taking that on formally as a department, is pursuing the certification to provide that daytime crisis response within PHHS.
Yes, so to follow up on Jerry's question, the local crisis responders are available Tuesday, 5 p.m. to 8 a.m., weekends, 5 p.m., Monday through to 8 a.m., and then all day holidays, so any non-business hours. But Birch Tree Center is staffed 24/7. There's always somebody there. So again, to contact the crisis provider, you contact the 623-1800, and there'll be a voice prompt. If it's a business call, you push 1. If it's a crisis call, you push 2. And we actually call that number a fair amount here in our own agency to consult if we have a situation that we're responding to. It's wonderful to have somebody who's not involved in the situation to talk to and say, these are the steps we're planning to take. So they're, what do you recommend? And they'll suggest some other things. And it's really great to have that consultation support.
I have a question. So the hours down there are different than yours. When do you take place? When do you respond?
So.
Or aren't you there yet? Okay.
That right here is.
Yeah,
Okay.
yep. So Monday through Thursday, starting at 5, ending at 8 a.m. the next day, and then all weekend, starting at 5 p.m. on Friday, ending 8 a.m. Monday. And then for holidays, we're on call 24/7. So that's when you would get a local responder, most likely. Yep.
Okay. And meaning, how many, do you rotate services then? Rotate time?
Yep. It's I usually do 1 week a month, and it runs starting on Monday and then through Sunday.
Yes, and that's a really good point. So once the call is made and it's transferred to the local responder, a lot of things can be handled on the phone. A lot of times people just need somebody to talk to. But if you determine that somebody needs somebody just face-to-face, the crisis responders will meet that individual at our North Shore Hospital not in the emergency room, but there's a special waiting room, but the responder will wait for the person at the front door, walk them in, contact the emergency room and let them know I'm coming in, so that they know that who is this person in the hospital. But there's a waiting room where you can meet with people one-to-one, and if things are still becoming more complex, you can walk that individual right over to the emergency room and they can be admitted. So there's a lot of options and depth by meeting at the hospital. I can't say enough about how helpful Kimber Ralstead has been in this whole process and really making the hospital available. There's rules that say if you walk through that hospital door and you don't go into the emergency room, can the hospital be liable? But she and her attorney did a lot of workarounds so that we can have that space. There's not a lot of places to go 24/7 in Cook County. It's the hospital or the jail, and certainly we don't want to meet in the jail because it's not it can be criminal. It gives the sense that you're criminalizing somebody's health condition. But the hospital's been a great place to meet, and they've been very generous with their space. Again, the responder will listen, and sometimes it's just helpful to speak your truth and be heard and seen so that somebody knows what's going on, and somebody saying it out loud can be really, really powerful. But if the person needs more support, as I said, we can meet at North Shore Health, and there's no charge. I think that's the other thing. People will be supported. So one thing, if a person is experiencing significant distress or has a specific plan for suicide or homicide, they will be taken to the emergency room. And I think that's another thing too. If you're talking to an individual and they say, I have a gun here right now, it's loaded, I'm going to shoot myself, we will contact 911 and law enforcement will intervene. We're obligated to do that. It's a requirement. We cannot talk somebody through that. So that is the level of response. So in a sense, all these calls are confidential until that point that a person says they are prepared to take their own life. We don't.
And meeting at the hospital does not mean you'll be admitted.
Correct. And I think that was an important workaround too, because some people don't have insurance, or they have an insurance with a high copay and they don't want to pay $3,000 or $2,000 to go to the emergency room. That might be the right step for them, and that's why the crisis responder is meeting them there. And have you had experiences where you assisted people to get to the ER, or generally are you?
I've never had to do that. It's always been resolved in other ways, which is ideal.
I just don't want people to have more anxiety and be afraid to come in when they need to because they assume that it will escalate when it doesn't need to.
Yeah. Yes, that's right. So yes, this is the steps at the hospital. And so we have a team that meets monthly. We call it our Crisis Response Multidisciplinary Team, and it includes the hospital, law enforcement, our agency, Violence Prevention Center, the clinic. Did I say law enforcement? Yes. So we meet as a team and we talk about our processes. It's just like any kind of emergency preparedness response. You develop relationships, you talk about your processes. When things go well, we talk about what help them go well. When things didn't go as planned, we talk about what had happened then. One of the staff people at the law enforcement, Jamie Green, has participated in crisis intervention training. It's a 40-hour training with mental health professionals and other law enforcement people. And that's really great to have that insight. There's also somebody who is hired by through the regional grant for mental health. I think his name is Doug Jones. He goes by Jonesy, so I forget his first name sometimes, but he's a former a police officer for DPD, and he has just been a great advocate to increase the number of the crisis response. And so they have a social worker embedded in their Duluth law enforcement team who goes out, because there is so many times people are called on mental health emergencies. A lot of the training that Jonesy and other people do is funded through the Barbara Schneiderman Foundation, and Barbara Schneiderman was an individual with a major mental illness, and law enforcement responded to her. This is several years ago, and she had a table knife, and they shot her, and she died. And so the family wanted to increase understanding and knowledge regarding mental health crises, and so they created the foundation, which funds training for law enforcement and mental health professionals. So some of the limitations in our crisis response team: crisis responders cannot provide transportation. So if an individual needs to get to a safe place, and I just want to say, before we start talking about Birch Tree Center, we say, do you have a friend or a family member who can provide you with support or to be there? You know, the best, when we're not feeling well, we want to be somewhere comfortable and familiar to us. That's the most healing. And if we can create that or find that or identify that, we will work to facilitate that. But if an individual does need to go to a Birch Tree Center, the crisis responders cannot provide transportation. So they help and try to facilitate it. We can provide gas cards to offset the cost of travel, but I think we still need to work out the kinks in delivering that and where to hold them. I think we thought we could hold them at the hospital, but then it became too complicated thinking about how to keep them safe, how to distribute them. So I think we're going to work with law enforcement to keep cards there on hand so that, you know, a person, so many times people say, yeah, I can drive them down, but I don't have any gas, or I can't spare gas for that. And we also, I don't know if the details have been worked out for this, but say it is the middle of the night or say that weather is bad, we would cover the cost of a hotel stay for that loved one to transport the individual down. We just want to get people safely to the right place. So again, our current challenges are that we have no daytime crisis responder. And we always have people on intake here at our agency, but our jobs are case managers and care coordinators, which means it's more predictable. We meet with people, we plan, we refer, we support. A crisis is a very different thing. It requires a lot of, you have to make yourself very available time-wise, so you may have to cancel appointments. You just have to respond and meet that person where they're at. And we want to, but we just really aren't. We do the best we can, and I think we do a really good job. But it's, when you're responding to a crisis, you may not, that may be your event for the day, which is good, but you have regular people that you're trying to support to prevent crises and to help them with their lives. So we don't currently have a daytime responder. And per statute, this service must be available 24/7. So we do have the phone crisis response, but we do not have face-to-face crisis response 24/7. And then the other thing is we do have one person designated as a primary intake person, that's Heidi Akins, but she also has other responsibilities. She's a licensor, she also does some case management, and when she's not available, then other staff back her up. And not everybody is equally trained in crisis response. Everybody is trained well in case management and providing those levels of care, but not everybody is trained to provide crisis response. So there's an inequity in response if we were to just use it in our staff. It's really important to have somebody properly trained in crisis response. And transportation always is a struggle for our people in Cook County needing medical care, and we are working on some creative problem solving. I can say that the North Shore Healthcare Foundation is digging into that issue, and we're just trying to figure it out. It's complex, it's intermittent, it's not a constant need where you could set up a business, it's so we're just trying to figure it out. And so all creative ideas are welcome. And I just want to, and then we need to inform more community members about the availability of this service so that people do use it and do feel comfortable with it. And then staffing is always challenging to find people who are qualified and available after hours and on weekends so that we have enough volume of staff. Last spring, several of us went to a regional training on rural crisis response, and the issues that we have are exactly the same issues that they're having in Bemidji, in Pine City, in Grand Rapids, everywhere. There's a lot of, so everybody's kind of struggling with the same thing. And so we're in it together, but it doesn't really change anything for that individual who's in need if they can't get places. And so it's really important for us to, that we meet regionally and talk about solutions to these common struggles. So that is all I have for a formal presentation. Dave?
Could you go back to the slide where it distinguished between emergency and crisis, please?
This one?
Yeah.
Yeah.
I didn't finish reading the whole thing, so.
Oh, not a problem.
Thank you.
Any other questions? Go ahead.
I don't have a question, I have a comment. Are these available in your office?
Yes, I have lots of them.
Do you have lots of them, like
Yes.
30?
Yes.
Okay. I'll take them as I travel around in the community
Oh,
and attend
wonderful.
other meetings.
Yeah.
I'll be glad to do that.
I can bring them, I'll bring them down for you.
Okay, great.
So to clarify there, an emergency is within the crisis umbrella, but not all crises are emergencies? Is that how that, I'm just trying to understand
Not
the
all
distinct.
crises are emergencies.
Yep, okay.
Yep.
That's, okay.
So emergency would be where my coping skills cannot meet the stress that I'm experiencing. And so you can imagine any situation where, a sudden loss, something, a traumatic incident. I think one good example of how this kind of service, kind of a parallel experience, is our own employee assistance plan here at the county. And I'm just thinking it's the time of year, it wasn't that long ago, several years ago, when we had the courthouse shooting, and that was traumatic for many, many people. And I know that many, many people depended on the employee assistance plan as a source of support, and it was so valuable. And to generalize that opportunity to our whole community through crisis response is really important. Maybe not the situations that people are experiencing aren't as community-wide or yet. If it's happening to you, it's important, and it's important to get that support and response, so.
Carla?
I'm assuming it's a parallel response to suicide. If you have someone homicidal, that there'd be the duty to warn the attendant victim, and you would involve law enforcement
Correct.
at that point in helping them get help.
Yes.
Yeah. And hopefully you won't have that.
No, right. But when people feel really hopeless, I think the responders, you get a training in suicide response and.
Yeah, yep.
We just do your basic assessment of method and means and provide hope and try to see what we can do. But if it seems like it's imminent, we do call law enforcement.
Go ahead.
Just another question about the same thing that Carla brought up. At some point, there's a crossover from crisis responding to involving, probably involving law enforcement at that point, and a hold order being issued. And so if the crisis responder determines that it reaches that threshold, then it becomes a call to law enforcement in order to get a hold order? Or who makes the decision of whether a hold order is in fact issued?
I suppose it would depend on the circumstance. If you're meeting with somebody at, like, face-to-face at the hospital, we would hope that we could walk them right over to the emergency room, and then it would be a medical hold. Sometimes, my experience in Cook County has been that police holds are placed without the involvement of crisis team. That something is evolving or happening, and the police hold is put in place, then the individual is taken to the emergency room for the response. But I don't know that we've often had it going,
So with law enforcement, if someone was on the phone with me and they are saying, I am going to hurt myself and I'm not going to come and meet with you face to face, that's going to be a call to law enforcement to say, I was just speaking with so-and-so. We try to get people's addresses when we initially talk to them, just in the chance that we do need to contact law enforcement so that it's easy for law enforcement to find them. Same if someone says, I'm going to hurt this other person. And there's just no other way to deal with it other than law enforcement going out and getting them, then, yep, that's going to be a call to law enforcement just stating this is what's going on and this person needs to be checked in on. And then it's up to law enforcement at that point. I'm usually not involved past that.
Right. I'm thinking back to when I was working in this area, and that there was a health or peace officer hold.
Yes.
I'm assuming that's still in the statute. So that if there was it didn't necessarily have to be a physician, if there was a psychologist or social worker who was licensed to work with someone who is mentally ill, they could initiate and sign a hold order. and then call law enforcement to transport the person.
You know, that you're absolutely right. Technically, that is in place. It just really hasn't worked that way in my experience here. But that's a really good thing to check in on.
Well, I think, again, with HDC not being in the picture, the access to another licensed mental health professional is, all of a sudden, is missing.
Carla?
I was just going to add, the beauty of you being at the hospital, because I've had homicidal and suicidal people, is that if you walk them to the emergency room, now it's not like an urban area with 1,000 employees, but they do see other bodies, and my experience always is that a lot of the impulses de-escalate just by you staying with them until they're going to be transported or whatever, and other people being around, there's a calming. Sometimes it's so calming you think they won't get admitted at the psychiatric facility because of what you've done. But I think that's the beauty of what you're doing.
I think once a person is admitted, if it's determined that they do require a 72-hour hold for their own safety and well-being, finding a place for that individual to go can be really challenging, and people are and that creates another layer of stress. You know, if you're transported to Fargo or to Minneapolis, then it's a one-way transport. You're transported there, but you don't get a ride back. So then you have to have family or loved ones to pick you up, and it's hard. It's really big and it's really hard. So I would say that that's part of the transportation struggle as well. So.
The other tangential issue that's raised is that even if they're transported, let's say to Duluth on a hold order, that doesn't mean that the hospital is going to keep them for any length of time.
Exactly.
Right.
And then they may be looking for a way, if they're suddenly discharged in Duluth, they may be looking for a way to get back home. So we've got the transportation issue again in another form.
So the whole idea is to have the best level of care as close to home as possible, so that we're not, instead of putting our energies into driving people around and picking people up, we're actually spending our energy meeting people's needs, helping them recover and find balance in their community with the loved one, their people around them. That's the best way to go, is to, so our theme is for the region is the right level of care at the right place at the right time. And so just to really tune into that's our goal. And just some visions that we would love to find that right home to be licensed as an adult foster care home, who could welcome a person into their home to get their footing, and instead of driving all the way down to Duluth and back. So we're working on it, but nothing's fast because there's a lot of licensing issues. You have to do it right as well. So,
Any other questions?
Just a comment, thanks so much for what you do. It's a very important thing, and I know with a smaller staff, it's very difficult, so I'm sure you're doing the work of more than one person. So thank you for doing that. And it's one of those things where this is the best thing to do to help people, but it also is preventative in nature, and not only for us, but for them, more importantly, them.
And if I could just echo that before we move on, I just really want to recognize and thank Grace for her leadership in this work. You might not necessarily have picked up on this through her presentation, but Grace has served on the Arrowhead Behavioral Health Initiative, on the executive team, formerly Region 3 Adult Mental Health Initiative, and the marketing committee for the Let's Talk campaign. So Grace has really been instrumental in the involvement of Birch Tree Center in that service being offered regionally, as well as the work on the Let's Talk campaign as well. So thank you so much, Grace. And also, too, if you read her Cook County News Herald article this week, you also saw just what a compassionate, person-centered approach she has to working with people in crisis. So thank you, Grace. And thank you, Anna, as well. We're so fortunate to have you as a member of the PHHS team in adult mental health, and just the wealth of skills and experience that you bring from your work as a crisis responder. So thank you, Anna. And also want to recognize the work of our local advisory council for mental health, newly formed local advisory council. They've been very engaged in this area of crisis response, in looking at gaps, transportation, marketing, how to get the word out about these services. So the local advisory council received a presentation from Grace several months ago. We've had some in-depth discussion, and they're actually forming a task force to look at mapping service needs in the area of behavioral health. So really thankful for our staff and the engagement of our partners in looking at what we can do to improve services locally.
Thank you. With the holidays coming up, just touch on a subject quick with that bold on the bottom. Remember, what may be a crisis for you may not be a crisis for another. For someone who struggles with a mental illness, specifically anxiety, sometimes a positive situation can trigger a crisis in someone. So just remember during the holidays, if you see someone struggling, they may not be going through a tragedy. Just life in general and being overwhelmingly happy can cause someone to be into a crisis. So just pay a little attention and always be there for a listening ear.
Thank you.
Thanks for your work.
Thank you, everybody. You're listening.
All right. Director's report.
Okay, so in the way of staff updates, don't really have much to share, other than just a little more context and information under the items for board action. Item B, thank you. So I switch between screens here. So I introduced this last month, that we're requesting approval for an out-of-class appointment for one of our staff members. This was discussed last month as a temporary project for Sarah to take on some additional responsibilities in the area of services to persons with substance use disorder. Sarah is already a key player in helping connect individuals who are referred to outpatient treatment services to the funding services and other supports that they might need to remove barriers to treatment. So we're proposing that Sarah take on additional responsibilities in a temporary capacity to help us look more comprehensively at this new role, this new service of substance use disorder treatment coordination. And then we are working on putting together a presentation schedule for our PHHS board meeting for 2020. If there are any staff or program areas that you would like to hear from, please feel free to let me know. I'm happy to consider your ideas, your feedback. We have a draft schedule put together that I can route if you're interested in seeing what we already have on the schedule. Looking at doing a year in review for 2019, similar to what I did last year. And then typically we have the Sawtooth Mountain Clinic staff come in early in the year as well and present on outreach and other programming that they're providing through a contract with our agency. In agency updates, you approved the financial report through November in the consent agenda. Just a little more information on that. Significant areas where we are under budget is in the Children and Family Services and Developmental Disabilities area. We continue to be lower than anticipated in our out-of-home placement costs. And then the Developmental Disability Service area is under budget due to that innovation grant that we had received through the Department of Human Services, and then really struggled in having that position filled here locally in working with HDC to retain and bring on someone to provide that service. So we ended up closing out that grant early because of those staffing challenges in 2019, which is why we are under budget. Let's see. So again, that financial report reflects our position 92% of the way through the year. We're under budget overall in expenses, but are at 95% for collections. So again, just want to recognize the diligence of our fiscal staff in pursuing all of those revenue sources. There are some delays in billing and collections. We have 60 days is our time frame for billing, and then 90 days for revenue collection. So we won't see that full picture for 2019 until into 2020, and Lori will be presenting that financial report for 2019 in May of next year. An update on the DHS payment errors. When I last was before you in November, I shared that DHS had identified a number of issues related to billing for services that would impact counties. Those were related to residential treatment facilities in which the county cost share was miscalculated. There were issues related to foster care payments that were claimed by counties, and there were also issues related to overpayments that were cited for cash assistance programming. So since our last PHHS board meeting, the Association of Minnesota Counties issued a statement that many counties are unable to pay for those miscalculated payments from their 2019 or 2020 budgets, as the levies were already set. DHS has also sent further guidance requesting written response from counties who are unable to pay. So I reached out to AMC and MAXA for more assistance on how to move forward. We are in a pretty unique position here in Cook County as the financial burden is quite low, but again want to be in alignment with the state and with other counties and minimize any additional work if there is legislative action to delay or postpone or remediate those payments to counties. Governor Walz, as you all know from attending the AMC conference last week, also took a very public stance on holding counties harmless for these payment errors. I just heard back from AMC and MAXA yesterday evening, offering some guidance to all counties on how to respond to DHS's very specific request for response. I had hoped to ask for your input on how to respond, but now I feel like I have a little bit more information, but want to share that with you and get your feedback on moving forward. Is this the stance that Cook County wants to take as well, as related to repayment or not, or delaying payment of these billing errors? So the letter, the sample language offered by AMC and MAXA, I'll just read to you now, is Dear Commissioner Harpstead, pursuant to your November 18th, 2019 letter informing counties of recently discovered DHS billing errors, and the follow-up letter on December 5th, 2019 regarding invoicing counties for substance use disorder institutes for mental disease, or IMD payments, we are informing you in writing that we do not plan to pay the billed amount. Last week at the Association of Minnesota Counties annual conference, the AMC Board of Directors adopted a motion recommending counties not pay for the SUD IMD billing errors. During the same conference, we were pleased to hear Governor Walz pledge to work with the Minnesota legislature to hold counties harmless for these billing errors. We are confident that by working together creatively and collaboratively, we will find a method for covering these costs from state funds.
Well, that's much nicer than how I would have said it. Even though ours is small. How does everyone feel about that response?
It's stronger than, it was, I guess as we talked a little bit before, there's just a fine line between, because the state was asking for a written notice of an inability to pay. So I think it's responsible to communicate, but they weren't asking for feedback about willingness. So I'm not sure, but I can put trust in you and AMC and MAXA to navigate that situation, and plus with what the governor said, and with a full AMC board, then, we're not going out on a limb by any means.
I think another approach that might get at that would be that we are delaying payment until the conclusion of the legislative session. And that would acknowledge that we aren't unable or necessarily unwilling to pay, but that we're just waiting to see how things play out statewide.
I like that a lot more, but I don't know. Oh, I don't know.
Again, that's much better than my response. We're unwilling to pay because this is stupid. Myron, did you have your hand up?
Well, I guess, I think it's good that we are consistent with AMC, and that we stick together on this. And, it's all a matter of relativity. Some say you can't pay. Well, how do you determine that? And so I think it's a good, safe way to go.
Ginny?
I'll bring this up now. I was going to do it a little bit later. So I'm on the Health Committee and attended for 2.5 hours the Human Services platforms, and I was in contact with Allison in terms of SNAP, and they did not support that. But there was an emergency amendment just in that regard, and so that's going to go, now there's a placeholder at the legislative session for redesign of what you're talking about, so hopefully, that letter and everything else will fall in place. That sounds good.
Redesign of SNAP?
No, of DHS.
Okay.
Yeah. So when they do an emergency amendment, that's pretty strong, that's important, that we need to have DHS listen to the counties, so we'll see what AMC says about that, too. And maybe that's some of the response that AMC gave to you because of this.
So Myron, were you more supportive of the AMC template, or the language about delaying, or did you have a strong?
Were you asking us for an option, I guess, on that, or my statement is that I think we should be somewhat consistent with AMC, but if they didn't come out with did they come out with a recommendation?
This was their recommendation, but they also acknowledged that that counties may want to modify that based on their individual circumstances or needs. So that's what I'm asking for today, is if there's consensus or a recommendation from the PHHS board on adopting the language as it stands from AMC or modifying that in any way.
And what I thought was a little more tactful was the delay wording, right? Which I appreciate that option.
I'd agree with that also.
But otherwise,
How's the board feel?
How much were we overpaid?
So specific to the SUD IMD, the residential treatment, it's a $2,000 incorrect payment. So the cost share that Cook County was responsible for was off by $2,000. And then again, there are 3 separate issues, but this letter is very specific to that one issue. And again, I've instructed our fiscal staff to hold off on paying, and then we would also want to go through the process of just confirming that that amount is correct. But again, we have the option of saying we will not pay or we want to delay payment.
Okay, so to clarify this more, if we say that we're going to pay after the legislation, what if the legislation is very nebulous? Then we're committing to doing something. I just, united we stand is my thinking, to be safe, but, I guess
We're not agreeing
your
to pay.
recommendation would be important to us, to me, but that's just a general principle I have, is stick with your
Dave?
organization.
Yeah, and I agree. I was just, kind of trying to dance with the wording as far as we would like to delay payment until we hear, at least until we, or, something, without committing to to paying, but certainly.
We would consider payment. If you say you delay payment, I'm sorry, then you're
Yep.
saying you're going to pay.
No,
Well, we
we're
can
not.
delay it indefinitely.
Yeah.
Oh, I thought you said based upon legislation.
Well,
You're saying that, but then if legislation comes back and says, we're not going to hold you harmless, we can respond at that point and say we're not paying.
And it's a very small amount of money, so that's not the issue. It's just keeping good with AMC and keeping good with the state and doing that dance. And so that's why I thought the delay, to wait and see what happens, is a good.
So, excuse me, AMC's position was to delay.
AMC's position based on this recommended language, their template states that we are informing you that we do not plan to pay the billed amount. That's what they're asking
that's my
counties to
point.
say.
Right, and I'm less comfortable with that, because that's sticking
Okay.
it to the state.
We're going to do a raise of hands. You
Oh.
get to pick one. Either you agree with it as originally written, raise your hand.
The AMC position.
Yes?
Okay, thank you.
Can you raise your hand? Okay, with the new language with Dave stating that we will delay until legislation, raise your hand. All right, we will go with that language, Allison.
Okay, thank you for your input.
I'll live with that.
Here's mine.
I gotta live with the levy, other people gotta live with letters. Any more
Yeah, a
updates?
couple other brief updates. As you all know, the changes to the Cook County Tobacco Ordinance were approved in November. I just wanted to circle back related to that. Following the approval of the ordinance change, a letter was sent to all of the affected retailers in Cook County, notifying them that that ordinance change was effective immediately, also connecting retailers with resources for training and notifying customers of that change. We have received some calls upstairs in PHHS. I know that some of you have been contacted by retailers as well. So we're just really working to get information out and connecting the retailers with resources. We received some window clings from the American Lung Association. We hadn't received those by the time that we sent out the notice to retailers and really wanted to be timely in getting that notice out. So just yesterday, our front desk staff mailed out those window clings to all of the impacted retailers. So some of them may have already received them. They'll be receiving more. We're requesting more from the ALA. I was also contacted by Mayor Aerosmith Deku with interest in getting information before the City Council. So I'm working with him as well on connecting him to information and resources to bring before the City Council. I have some disappointing news to share that we were just notified last week that we did not receive the Robert Wood Johnson Foundation grant that our department was pursuing, the Cross-Sector Innovations Grant to look at housing as a health equity issue. That was something that we were working on under the umbrella of our Community Health Assessment and Improvement Plan and hoping to partner with the EDA on looking at truly affordable housing as a health equity issue again. This is something that we still are hopeful that we can dedicate resources to in 2020 and bringing on that additional public health educator. That would be within the scope of their work is convening people around affordable housing and health equity within our health improvement plan, as that was the #1 issue identified by people who responded to our survey back in 2017. And again, just a bit more information on the items for board action before you today. We have recommendations for membership and election of the chairs for our local advisory council meeting. We have a new applicant, Carly, who works at Higher Ed, has attended several of our meetings and has filed an application to be a member of the committee, and also requesting that the board accept with regrets the resignation of Sherry Moe from that council. She shared with me that she really does hope to remain connected to that group, but is just unable based on her patient schedule to commit to the monthly meetings, but that she still will attend as she's able to in the future. We also had an election at our last meeting, recommending Andrea Orest step in as our new chair of that council, and Carla will be serving as our vice chair. I also want to add one correction to item B under items for board action. Within the summary information, the language in the board request is correct, but within the summary information, I want to point out that we failed to factor in the cost of living adjustment for 2020 in that salary projection. So there's an additional 2.5% that we did not factor into that adjustment for 2020. So the salary, the 2020 salary for that out-of-class appointment would be at step 5 at $27.68 for the hourly wage, not $27.01. And if there are any other questions on my report or the items for board action, I'd be happy to take those.
As far as the training for the T21, I'm just kind of trying to figure out what we didn't think of. I don't understand what the difference is. Isn't it just a different date? Or is there more to it that I'm not aware of?
I believe that's it, just the different
Okay.
date, but just
But those window
ensuring that,
plans
that the retailers and their staff have that information. Were recommended training, online training, that was shared by the American Lung Association that we referenced in that notice that went out on December 4th. The window clings to notify customers, and then there were some cards that we printed on cardstock as well, just reminding staff of that change, to check IDs and the year. I think it also referenced the year, the date of birth that they'd be looking for.
And then the other question I have is, in kind of the two big, well, just through some of the AMC sessions, and of course, the training, the ACES training in the community, and how childcare can be a role in our community's health, if that's an issue that we can have a more in-depth conversation at maybe one of next year's PHHS board meetings.
Absolutely. We have Heidi scheduled to present on licensing in July. Again, that's just going to be that high-level overview.
Sure.
It's certainly something that that our department sees a great need for. It's came through our community health assessment. It came through very strongly in the listening sessions that we did with families who have given birth in the last few years. I shared, I believe here, that 80% of the participants who responded to the focus group surveys and listening sessions shared that lack of child care was a factor in their ability to re-enter the workforce. It's something that our Early Childhood Coalition is involved in, and we have representation on that. But again, there's always more work to be done in building capacity and working across organizations, and how can we address this and move forward in action as well.
Yeah, I know that housing is, I'm sure childcare is too, a statewide issue, and housing is, and so I was just looking at.
Oh, Dave, it's vacation rentals.
Well, I
It's
think
all
they're very
connected.
related.
It's all
They are,
connected.
they are.
They are.
Yep, so
And
that's,
it's just, perpetuates the
yeah,
problem.
yep.
Has to be a concerted effort to take it on in several different factors and areas, yeah.
All right. Items for board action, approve appointment of Andrea for the chair and Carla the vice chair of the Mental Health Advisory.
I move that we go forward with that.
Support.
Any discussion? Yes, Sherry? No discussion, all right. All in favor?
Aye.
Hey,
Any opposed? Okay, and we also need the appointment of Carly Puck to the council and the resignation of Sherry Moe. We can do those together.
so moved.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? And then we have the out of class request with the correct wage that Allison gave us. Can I get a motion for that?
I'll move.
Support?
Support.
Any discussion?
I'd just like to say, I appreciate you and your department looking at our needs in the county and being flexible and always evaluating how best to meet those needs and planning planning ahead. This is in the 2020 budget, and it'll help our community, so thank you.
All in favor?
Aye.
Any opposed? Excellent. Thank you, Sarah, for stepping up and stepping out and taking on more responsibility. You've done a lot of that in your time here, so it's very much appreciated. Arrowhead Economic Opportunity, Mr. Mills.
Nothing to report.
Arrowhead Health Alliance, Mr. Mills.
Nothing to report.
That's the one tomorrow, right?
Mhm.
Allison, I'll be upstairs on, or Sarah. Sarah gets the owl running or whatever, I'll come upstairs and do that meeting. Arrowhead Regional Corrections, Bobby?
We meet on Friday, and I talked to a few of the other members that are on the interview board for the director of ARC. I guess we're down to 2 candidates now, and we'll be discussing that at the meeting Friday. And we have some interesting positions that a few of the St. Louis County and Carleton County commissioners are looking at, so it should be interesting.
Yeah, they're in mediation right now with their own staff, so
Who is?
feel for them,
St. Louis County.
Oh.
St. Louis County. Unless you listened to the news yesterday, they were in meditation. Thought that was interesting. I'm like, maybe if you did some meditation, it would go better.
Hand in
Do
hand.
that before mediation.
Yeah.
ARDC, Jenny?
Nothing to report. We'll meet again in January as a whole commission.
Okay. Community Health, Mr. Mills?
Yeah, Alice and I, we're down in Duluth, and it must be at the Government Services Building. Is that where ARC is as well, Bobby? In Duluth, is that where you meet as the Government Services?
No, we meet up
Oh.
at the work bar.
Oh.
Go to jail for that meeting.
Yeah. And so did the first round of interviews for, it wasn't all of the first round, but we started the first round. We'll be back down Thursday or I will be. I don't know if Allison will be able to be there in person or via video, but I'm just really happy that we're involved with that, and there's good candidates so far, and, yeah,
Awesome.
5 candidates total at this point.
Public Health and Human Service Advisory, Carla and Jerry?
We did not meet in December. We'll be back to report in January on our year-end review and the results of electing a new chair and vice chair for that committee.
Excellent.
And on the Mental Health Council, you heard many of the things from that meeting today, but I think one of the takeaways from the roundtable discussion was Inger Anders explained the development process of the Restorative Justice Program in the county, and as you know, North Shore Healthcare Foundation is becoming their physical agent. That's important. And she also talked about how this is such a powerful and helpful intervention for people involved. And Grace Richard gave us an excellent, as she did for you, presentation on the crisis response. We have been working, as Jim Boyd had brought forward the concept of as we mentioned last month, of using mindfulness in the schools. So we're using this time until our next meeting to look at different models. And California apparently has integrated a lot of this and done well, and we're all supposed to look that up and look at other models as well. In January, we're going to have a presentation on ACEs. 5 of the council members went to the train the providers, and so they will be presenting that. I believe Allison mentioned that in some of our talking about the crisis response and also getting out all the information to the community, that a task force was formed of 8 members of the council to begin meeting on that. So we are alive and kicking.
Excellent.
That's it.
And then the next one we have is healthcare planning, Ginny.
Yes, we did meet. I don't have anything important or of interest to report, other than I want to just bring up how AMC will be presenting their platform in February. We'll get it before then, but, so AMC is now supporting procurement process for county aid. They're supporting child welfare in reducing disproportionality. They are sponsoring and wanting to protect counties from DHS financial errors, and they're supporting mental health and substance use. So those are the areas from Health and Human Services, which we got at the end of the meeting.
does that
That's all I
mean?
have right now.
What does that mean, supporting?
They will support, from the Health and Human Services, that is their platform to support going into legislature.
Okay.
Platform amendments and all that.
Right, but you said they're supporting mental health and substance abuse?
Use, substance use.
Okay, that sounds strange to me.
Well,
Treatment?
Treatment? Okay. I mean, they're not
Could be.
supporting that you get a mental health or a substance
No.
abuse disorder.
no.
That's South Dakota, I think.
There's something missing from that statement. I'm like,
Somewhere else.
Isn't that South Dakota, or no?
I don't
That's
know.
something.
Another state?
Yeah.
Must be. That's what was reported.
okay,
That's all I will report to.
yeah, something's missing
Okay.
from there. Okay, North Shore Collaborative, David.
We did not meet.
Emergency preparedness, Ginny and Myron?
Nothing significant, I don't think, with just general business.
Okay. And anyone for the good of the order? We have a new member of our public health staff. We had a public health staff had a baby, and I'm not going to give out personal information, but I just want to say that that is for the good of the order, that all are healthy and well. All
So
right.
we can't ask the sex, that would be.
You just said that word live stream there, Carla. Way to go for ending the year. That would be great for the good of order.
You're welcome.
And we will adjourn. Thank you so much.
Oh.